Hey everyone, my name is Emaan Chaudry.
And my name is Danielle Solish, and you're listening to our ninth episode of Seeing Clearly, which is a pre clerkship guide to all things ophthalmology. On today's episode, we are going to be interviewing Dr. Nina Berrocal.
Dr. Nina Berrocal is a retina and vitreous disease specialist. She completed her undergraduate degree at Princeton University and then went on to complete her medical school and residency in ophthalmology at Tufts University. Following her residency, she completed a vitreoretinal and uveitis fellowship at the Bascom Palmer Eye Institute, where she has remained since.
Dr. Berrocal is a world leader in medical and surgical management of the retinopathy of prematurity and pediatric vitreoretinal disorders. She has been the first surgeon to treat the youngest patient in the United States with the first FDA-approved gene therapy. She has also devoted lots of time to teach and support women in the field of ophthalmology and retina. So without further ado, we would like to introduce Dr. Berrocal.
Well, thank you so much. That's every time I hear everything that I've done, it sounds kind of like not it's my imposter syndrome, coming out into the forefront. But yes, here I am. So yes, guys, thank you for having me.
Well, thank you for being here with us today. I guess we can just jump right into our first question if you're ready,
Yes.
which would be what drew you to the field of ophthalmology?
Well, I come, a little story about me. I come from a family of ophthalmologists. My father was the first retina specialist in Puerto Rico, and my sister is a vitreoretinal surgeon. I always say that this is an X-linked disorder in my family. But I will tell you that I fought it. I went to Princeton. I major in political science. I work in Congress one summer. I tried very hard to do something else. And I graduated from Princeton, went back home. I had no idea what I wanted to do. And one of my one of the guys I used to babysit for his son when he was little owned or was the I guess a law firm. He was a partner in a law firm, his own law firm. And I wanted to maybe do a paralegal summer or a paralegal year. And I went to talk to him, and he said, Nina, I love you too much to hire you. And I'm like, oh my God, who says that? How can I be listening to this? And he goes, I when I look at your father, I think your father is so much happier than I am. I'm not gonna hire you. You should rethink your life. And honestly, when it came from somebody that knew me as a little girl, I used to be a little girl taking care of his kid. I sometimes feel that the universe speaks to you, honestly, and you fight it and you don't hear it, but it's coming again and again and again in your life, and I think that what has my life been, it's a series of opportunities that I've had and a series of people that have come into my life to lead me in the right direction. And I know that sounds kind of like I don't know, kind of like new agey, but I truly believe in that. And after that, I decided, well, maybe I should just do medicine. Maybe I should give this a try. Maybe I'm just and I'll tell you, when I work in Congress, I was so disillusioned by politics. I thought that I wanted to do something for the good of the majority, and I felt that it was all real politics. I mean, it had nothing to do with the greater good. So then I decided to do medicine, and here I am, honestly. So
No, that's an amazing story. I feel like now there's still some people in my class or someone in my class who was in law school, a lot of people working in different fields, and then something just leads them to the path of medicine, and it's quite excellent, and it just shows where you belong.
and let me tell you, even in medical school, I fought it. I said, there's no way I'm going to do ophthalmology, right? I want to do something else. And I went through every subspecialty. I really like kids. And I thought, I'm going to be a pediatrician. Yeah. And then I did peace on the wards. And I'm like, ugh, I don't think this is for me. Then I did some, I mentor or was like a big sister for kids in cancer and chemotherapy. And I thought maybe I should do a pediatric hem-onc. I love kids. This would be great. And then I was like, there's no way I can do this for the rest of my life. I'm going to be depressed my entire life. And I thought about urology, and I really like pediatric urology because, the sex reassignment and all those things, I enjoy that. But when I did adult urology and it took this man like 15 minutes to tell me that he was there for an erectile dysfunction, I said, I can't spend the rest of my life waiting for men to tell me what's wrong with them. So, so then I went back to ophthalmology and I said, this is the perfect combination of surgery and clinic. And I think in this field, I can be a mom, I can be a wife. Being a mom for me was very important. I knew for sure that I wanted to be a mother. Um, and, I thought that that was the perfect combination. I remember my sister telling me, Nina, you have to think about 20 years from now. What do you want to be doing on a Friday night or a Saturday afternoon? And you have to think that way. You can't think about the here and now because you change and you have goals and aspirations of family, maybe no family, but you want to be a traveler or you want to work in different countries. So, you have to kind of have a sense of who you are and what's going to make you happier.
Mm. No, yeah, I completely agree. It's very important to think, even though things can change, it's important to think far down the line. Yeah, so thank you for sharing that. That kind of leads me to my next question, which is what aspect of being an ophthalmologist do you personally find the most rewarding?
I think that vision, the power of vision and giving or preserving vision for patients, it's like nothing else. I understand there's cancer, there's life, you can prolong life for patients, but I will tell you, I have this woman that I can clearly remember who had gone through breast cancer twice in her life. And she told me that I repaired her retinal detachment, and she told me that she would rather die than lose her vision. And like this, I have lots of stories. I do a lot of retinopathy of prematurity, and luckily in this country that the management and the amount of blindness we see from it has decreased severely. But in the rest of the world, we see it. I have kids from Central America that come to me completely blind because there was nobody to screen them and nobody to treat them. And that is devastating because you know that these kids in a third world country are not going to be taken care of. There's no early intervention. They don't go to school. They get ignored. So it's devastating outside a first world country. So for me, I think being a pediatric doctor and dealing with families and longevity of that relationship has been very rewarding. I have kids now that I treated when they were born, and they're 18, 17 years old now, and they come and they hug me and they talk to me and they remember this and remember that. And that relationship for me is priceless. And the surgery part of it is very challenging. No two cases in pediatric retina are the same. So it's a very challenging field. It's a very rewarding field, and now it's changing so quickly. Now it's all gene therapy. It's all going to be gene therapy for the years to come, and we're going to be able to hopefully cure blindness, which there's nothing more powerful in my mind.
Oh, it's amazing to see that you have such a long-lasting impact on your patients, and it's something that not only stays with them but stays with you as well, which is amazing to see. Because it seems like it's an aspect of your job that you love, and I mean that's obviously extremely important when you pick what you want to do. And thank you for sharing, I guess, all of the paths that you took to becoming an ophthalmologist, because it seems like you truly kind of figured out that that's what was most rewarding for you, and that's what you ended up doing. So thank you for that. So we mentioned it a little bit at the beginning of the episode, but you're involved in some areas outside of your practice, I guess. For those who don't know, Dr. Berrocal wrote a book called Women in Ophthalmology. So do you mind speaking a bit about that book and what inspired you to be a part of it and what some of the topics are in the book?
Yes. I was lucky enough to have this wonderful fellow who came from Johns Hopkins, and her name is Christina Wang, who's my co-editor in the book. And Christina was my fellow. Then she went on, now she's an attending at Baylor. And she came up with this great idea, and she goes, can I talk to you at one of the academies? And she says, I have this idea, and I want you to co-edit this book with me. And it's her baby, really. I just helped her find the right people for the right chapters and create like this book that was all encompassing. And it's been a great experience for me. I remember reading the chapters when we were editing them, and I'm literally crying in some chapters because they were so real and so honest about the path that we as women and the sacrifices we make along the way to make our dreams come true. And some of these chapters are, I will tell you that they're really raw for medicine and really raw for us in this field. So I recommend that book not only for women but for men, because it gives you a range. We have chapters about starting your own private practice, what it is to be in academia, giving a talk, what to do, divorce, having children, how to manage having children, retiring in ophthalmology, how to plan your retirement, what to do when you're sick or one of your family members is sick. So we really go through a whole scheme of your life, really, from being a medical student, wanting to go into ophthalmology, to retiring as an ophthalmologist. So, you know, every chapter teaches you something that is very important, and that you will use in your life. And it's one of those things that you could have at your night table, and when you have a hard day at work, just randomly open it to whatever chapter and read it, because there's always something there that you will learn something from that you can use in your life.
Yeah, no, I think sometimes I think about that, the fact that there's so much that goes on that no one speaks about so like raw and transparently. And so that's so excellent that there was an opportunity to share those stories with everyone in a way that's like tangible and everyone can access, because it is true. A lot of people go through things in silence and don't realize other people are having some similar struggles. So that's
Uh,
amazing.
uh, Yes, and I'll tell you that one of the greatest things, we have this group that we've started called the Vitbuckle Society, and it was a group of us. We started this maybe 10 years ago, maybe a little bit more. And within Vitbuckle Society, one of the things is an all surgical meeting, and we wanted to be different, and we created this from scratch, and it was going to be one of these meetings where we're able to talk about difficult things. And it's really a surgical retina meeting, but we decided to talk about mental disease. We decided to talk about pregnancy, hiring a woman versus a man. Um, all these topics that nobody really wants to talk about, that I think are so important. And one of my wonderful ex-fellows, who's now attending at Coli Center in Cleveland Clinic, had this great idea of having a webinar about infertility and the options about childbearing. And it's something that we don't talk about in medicine, because remember, we are in a system that was created by men for men. So there was no space there for us to be pregnant, for us to have children. Think about that. One of my attendings, when she was at Bascom, the first attending to be pregnant, she had a week off after delivery. So, from there, and I know this woman, from there till now, it's better, but it's not perfect. So I will tell you that I think that her webinar was amazing, because we had, a gay man who had a surrogate. We have a woman who went through many cycles of infertility. We had another one that needed an egg donor. So we wanted to offer to young women the options that you can have in your career, because nobody talks about this. And suddenly you're done with fellowship. I was done with fellowship. I took 3 years off after college. I was done with fellowship at 34. So at 34, here I am trying to get pregnant. And I remember my husband's a urologist, and my husband would tell me, Nina, when women make it, couples make it to age 35, 50% of those couples will have infertility problems. So, who tells you about this? Nobody. So one of the important things is that this webinar, you can find this webinar online, and it's amazing the options that you have. I have another fellow who decided to freeze her eggs, and she was about to marry this guy who was not a good fit for her, but she, the biological clock is ticking, and you have this guy and he wants to marry you. And we sat her down one time. We're like, is this the real, think about what he wants and his life and your life, the age difference and all this. And we told her maybe you should talk to an OBGYN about, egg harvesting. And she did it. And lo and behold, 2 years later, she found this amazing guy that fits her life, fits everything that she wanted. And now she has the ability of choosing the right guy, not because her biological clock is ticking and you feel that you have no chance of having children, but because she empowered herself to be able to do this.
Mm-hmm. Yeah, no, that's first of all, that's incredible. And I hope to watch this seminar because that sounds amazing. But on top of this, the truth is that medicine is such a long journey and such a critical time of one's life, like growing up and, aging, especially with the biological clock, as you spoke about. And that's something that, people are so focused on getting through medicine and getting through their residency and getting through their fellowship, and they stop to think about other long-term life goals. So that's excellent. So yeah, thank you for sharing that. And I'm sure our listeners will really appreciate that as well. And then I guess this is just a final question that we have in terms of the more like academic ophthalmology questions. Is do you have any last pieces of advice for our listeners who are interested in pursuing ophthalmology?
Yes, I think that, ophthalmology obviously is very competitive. I think that you should, if you're in medical school and you make it to your fourth year and you haven't figured out what you want to do, maybe a gap year is not a bad thing where you can, figure out what you want to do. Maybe you decided too late, and a gap year is a great thing. You can find somebody who will support you, and you can write articles, you can shadow them. And I will tell you, in ophthalmology, people are very nice. I've never met people who will say no, both in private practice and in academic medicine, to bring somebody in to help them, bump, make their application better. So at Bascom, we do that all the time. Right now I have a medical student that's been with me for between her third year and fourth year of medical school, that's spending with me a year, and she, in like 4 months, she already has 6 papers. So, things like that that really are going to make a difference to your chances of getting into a better program. A lot of medical schools don't have a good ophthalmology program, and you're left, not being able to build that application up to be competitive. But, there's always a way. And honestly, if you end up doing what you really like, a year on or a year off, it doesn't really matter, as long as you get into a program that's going to train you well. So, ophthalmology is great. People are happy. I've never met an unhappy ophthalmologist. If they're unhappy, it means that they chose the wrong field. Because I will tell you, all of my colleagues, I mean, we're very happy people. We love what we do. And, we want to make people do what we do. That's why we bring everybody into our lives. We let them shadow us a million times. It doesn't matter who you are, and we'll always be helpful. And, we know, I have friends all over the United States and Canada, and Latin America. So if there's somebody who needs to write papers with anybody, you can contact me, and I'll put you in contact with somebody I know. But there's always, just ask for help. There's nothing better than to really, go out there and write emails or call somebody and say, this is what I'm looking for. Can you help me? And some of us will do that every single time.
Well, thank you for the advice and the honesty. I think the one thing that I took away from that is that most ophthalmologists, and honestly physicians in general, are willing to help, and they want to support students. So reaching out is always, the first step. And if I've learned anything from this podcast, all of the physicians that we've interviewed have been amazing and so kind and willing to help out as well. So really do take the time for our student listeners to reach out, because you never know who's going to respond to an email, and most of the time, people are willing to help. So definitely would take that advice, and thank you for that. Um, with that, that's kind of the end of our academic questions and ophthalmology related questions. For our regular listeners, they know that we transition into a more fun segment of the show, which is Would You Rather? And so I'll start with the first Would You Rather question, then Danielle will do the second.
Okay.
So would you rather live where it is constantly winter or where it is constantly summer?
Oh my God, constantly summer, for sure.
Yeah,
Yes.
I feel like that's a pretty easy one. I would also go with
Yes.
summer.
Me too. Warm weather would be nice.
Yeah.
And then the second question is, would you rather be a character in an action-packed thriller or a romantic comedy?
Ooh, I would have to say a rom-com. Just because even though, maybe if you would have said the X-Men versus a rom-com, maybe I would have said that I would rather be in the X-Men. But, being a mutant is an interesting thing for me. But in that scenario, I would have to say rom-com. Yes.
Tends to be happy endings in rom.
Yes.
Yeah.
Yeah.
More fun to film, I guess.
Yes.
So with all of that, I just wanted to say thank you again for being a part of this episode, and for all of the advice that you've shared and all of the resources that you've talked about, including your book, Women in Ophthalmology. Sounds like an incredible resource for our students to use. And so thank you to everyone else for listening to this episode of Seeing Clearly. It's our pre-clerkship guide to all things ophthalmology. To stay caught up with everything else iCurriculum is doing, be sure to check out our website at www.icurriculum.com and follow us on Instagram at iCurriculum. Thank you again for being with us and for everyone who's listening.
Thank you for having me.
Thank you. Bye, guys.
Bye.